Basic life support, or BLS, is a critical, life-saving first aid procedure performed during emergencies such as cardiac arrest or drowning. It involves a series of steps designed to maintain a person's airway, breathing, and circulation until professional medical help arrives. Imagine yourself at a park, enjoying a sunny afternoon with your family, when suddenly you notice a commotion. A person collapses nearby, unresponsive. Time seems to stop. This is where knowing BLS can make all the difference. By understanding and acting swiftly with BLS, you can potentially save a life. BLS is not just for medical professionals, it's a vital skill everyone should learn. From stay-at-home parents to office workers, the ability to perform BLS transcends professions and age groups. Whether you're a concerned citizen or a first responder, being equipped with BLS knowledge empowers you to respond effectively in emergencies. Recognizing an emergency is the crucial first step in providing BLS. Every second counts, and a prompt response can significantly impact the outcome of the situation. But how do you know if someone requires BLS? Look for signs of unresponsiveness, such as a lack of movement or reaction to touch or sound. Another critical indicator is the absence of normal breathing. Check for chest movements. Listen for breath sounds and feel for exhaled air against your cheek. If you notice any of these signs, it's time to take action. Remember, the faster you recognize the emergency, the quicker you can initiate BLS and improve the chances of survival. After recognizing a potential cardiac arrest, the next immediate step is to activate the emergency response system. This means calling 911 in the United States or your local emergency number. Time is of the essence and swift action is crucial. Don't hesitate, even if you're unsure. It's better to err on the side of caution. When you make the call, provide the dispatcher with clear and concise information about the situation and location. This information allows them to dispatch the appropriate help promptly. Stay calm and answer their questions to the best of your ability. Once you've alerted emergency services, it's time to assess the victim's breathing and circulation. Begin by checking their airway. Gently tilt their head back and lift their chin to open the airway. Look, listen and feel for any signs of breathing for no more than 10 seconds. Observe their chest for movement, listen for the sound of breaths, and feel for exhaled air against your cheek. Next, check for signs of circulation. Look for any movement, coughing, or breathing. If there's no sign of breathing or circulation, it's time to start CPR. Section 5. Performing chest compressions. Chest compressions are a vital component of BLS, simulating the heart's pumping action to circulate blood to the vital organs. To perform chest compressions, place the heel of your hand on the center of the victim's chest, between the nipples. Interlock your fingers and keep your arms straight. Position yourself directly over the victim's chest and begin compressions. Push down hard and fast, aiming for a depth of at least 2 inches for adults. Maintain a rate of 100 to 120 compressions per minute, which you can time to the beat of the song Stayin' Alive. Section 6. Delivering rescue breaths. After 30 chest compressions, it's time to deliver rescue breaths. Open the victim's airway by tilting their head back and lifting their chin. Pinch their nose closed and seal your mouth over theirs, creating a tight seal. Give 2 rescue breaths, each lasting about 1 second. Watch for the victim's chest to rise as you deliver each breath. If the chest doesn't rise, reposition the airway and try again. Continue cycles of 30 chest compressions followed by 2 rescue breaths until help arrives or the victim shows signs of life. Section 7. BLS for children. Key differences. While the basic principles of BLS remain consistent for both adults and children, there are some crucial differences to keep in mind. When performing CPR on a child, use 1 hand instead of 2 for chest compressions. The depth of compressions should be about 2 inches for children. For infants, use 2 fingers to perform chest compressions, aiming for a depth of about 1.5 inches. It's essential to remember that children's airways are more delicate than adults, so be cautious not to overinflate their lungs during rescue breaths. Section 8. The importance of formal training. While this essay provides a basic overview of BLS, it's crucial to emphasize the importance of formal training. Hands-on practice with certified instructors equips you with the skills and confidence to perform BLS effectively in real-life situations. Formal training courses provide opportunities to practice on mannequins, receive feedback from instructors, and ask questions. This hands-on experience is invaluable in preparing you to respond confidently and competently during an emergency. Section 9. Conclusion. Be prepared. Save a life. Mastering BLS is an empowering act that equips you with the ability to make a real difference in life or death situations. By understanding the steps involved in providing BLS for both adults and children, you can act swiftly and confidently during emergencies. Remember, time is of the essence in these situations, and every second counts. Consider enrolling in a formal BLS training course to gain practical skills and knowledge. By being prepared, you can potentially save a life and make a lasting impact on someone's world.